Good morning, ladies and gentlemen. Today, my topic of lecture is a very important topic, which has always confused me. And I would like that this should not happen to any of you, because whenever we read about the pathogenesis of a condition, we always come to these terms, that is type 1 and type 2 inflammation. It is important to know that which of the disease you are reading is type 1 and type 2 because the cytokines which are related to these two kind of inflammation are different, and of course the treatment strategies are also different. So I would like to take up this important topic, that is type 1 and type 2 inflammation, the theoretical and practical aspects today. And I am Professor Ashar Ahmed Mashood. Introduction. Type 1 and type 2 inflammations are distinct immune response patterns with different cellular mediators and treatments. The type 1 immunity mainly involves T helper 1 cells that target specifically the intracellular pathogens like viruses and certain bacteria, and is associated with several autoimmune conditions. While the type 2 immunity involves T helper 2 cells that target specifically the parasitic infections and is linked to several allergic conditions and inflammatory conditions. So, type 1 immunity involves T helper 1 cells. It is a response mainly generated against bacteria, certain bacteria and viruses. And in addition to that, this response is important in several autoimmune conditions that include several autoimmune skin conditions. While the type 2 inflammation is started by T helper 2 cells, and it is mainly against the parasitic infections, but it is important in the pathogenesis of allergic conditions and several inflammatory conditions. The key difference between the type 1 and type 2 inflammation lies in their cellular mediators and their purposes. So, the key characteristics of type 1 and type 2 inflammation. As already highlighted, the type 1 inflammation targets the intracellular pathogens like virus and bacteria. It starts with activation of T helper 1 cells. Then it activates the T suppressor cells, that is CD8 positive T cells and macrophages. So it produces the cytokines like interferon gamma and tumor necrotic factor alpha. You have to remember these few cytokines. Interferon gamma and tumor necrotic factor alpha are the main cytokines. In addition, there are other cytokines as well. While type 2 inflammation targets the parasitic infection, particularly the helminths, it involves the activation of Th2 cells and then eosinophils, basophils, and mast cells. So, all the diseases in which you see a proliferation or increase in quantity of eosinophils and mast cells and basophil are type 2 inflammations. And it produces the cytokines like interleukin 4, 5, and 13. Further about type 1 immunity. Purpose, I have highlighted the main purpose is this. Key cells are Th1 cells, T bet positive innate lymphocytes called as ILC1S, the natural killer cells, and CD8 positive cytotoxic T cells. And the key cytokines they produce is interferon gamma and tumor necrotic factor alpha. In addition, it produces interleukin 2, 12, 17, and 23. Mechanisms. Since it's the macrophage induced activity, it drives phagocytic activity, activation of mononuclear phagocytes, and destroy the pathogens. This is the prime objective of this kind of immunity. Type 1 inflammation is characterized by intense phagocytic activity because it causes the stimulation of macrophages, which is stimulated by Th1 lymphocytes and secrete interferon gamma, interleukin 2, 12, and tumor necrotic factor alpha. The type 1 cytokines cross regulate and decrease the level of type 2 cytokines. Type 1 immunity is generally protective against most infections. The type 1 cytokines favor the development of strong cellular immune response. So, this limb of immunity is mainly the cellular immunity, a response generated by macrophages or phagocytic activity. In contrast, the type 2 immunity purpose I have already described against helminths, against allergens, and it also contribute to tissue repair and metabolic homeostasis. Th2 helper cells are the main initiator of this kind of immunity. And in addition, it involves ILC2 S cells, the eosinophils, the mast cells, the basophils, and interleukin 4 and 13 activated macrophages. So the key cytokines of this limb of immunity are the interleukin 4, 5, 6, then 10 and 13, and 25 and 33. Mechanism, it involves complex inflammatory response involving high antibody titers, promotes the elimination of large parasites, and facilitating the tissue repair mechanisms. Type 2 inflammation is mainly the humoral limb of immunity. So it is associated with high antibody titers, which are stimulated by T helper 2 cells and secretes the interleukins, which I have already mentioned. Type 2 immune response can be either host protective or have the pathogenic activity and are involved in anti-helminthic immunity. Suppression of type 1 driven autoimmune diseases is also created by type 2 response. Neutralization of toxins, maintenance of metabolic homeostasis, regulation of wound repair, and tissue regeneration pathways. So interleukin 4 and 10 are known to decrease the cytokines which are produced by type 1 immunity, that is the tumor necrotic factor alpha and interferon gamma. So the cytokines which are produced in type 1 immunity suppress the cytokines which are produced by type 2 immunity, and the cytokines which are produced in type 2 immunity try to suppress the cytokines which are produced in type 1 immunity. So it is an interplay between the cytokines of the two limbs of immunity, and one of that limb succeeds in pathogenesis of a particular disease. The type 2 cytokines induce complex inflammatory response, which is characterized by eosinophils, mast cells, and basophils. And interleukin 4 and 13 condition macrophages. And it is crucial in several allergic and fibrotic disorders. Eosinophils are involved in combating parasitic, bacterial, and viral infections and certain malignancies, and are implicated in a wide array of upper and lower respiratory disease states, including asthma, eosinophilic granulomatosis with polyangiitis, the Churg-Strauss disease, chronic rhinosinusitis, and nasal polyposis. Now, I would like to highlight the certain skin diseases which belongs to a particular limb of immunity. So, first of all, the skin diseases that are associated with type 1 immunity. Type 1 immunity, as you all know, is characterized by Th1 cells and producing interferon gamma and tumor necrotic factor alpha, and drives inflammation and cytotoxic T cell activity. So the first and foremost disease which belongs to type 1 limb of immunity is psoriasis. It's a chronic inflammatory skin disease which is driven by type 1 and type 17 helper T cells. The immune activity leads to rapid proliferation of cells causing thick and scaly plaques. So, all the medications which work against the cytokines that are produced by type 1 immunity helps in the treatment of psoriasis. The second condition which is associated with type 1 immunity is vitiligo. It's an autoimmune skin disease resulting in loss of melanocytes and patches of depigmentation. It is a T1 drive immune response with cytotoxic CD8 positive T cells, which are destroying the melanocytes in response to the cytokines interferon gamma and tumor necrotic factor alpha. Alopecia areata is another disease belonging to type 1 immunity. It's an autoimmune hair loss condition. Antigen specific T cells attack the hair follicles, triggering an immune cascade that leads to the hair loss. Lichen planus is another condition associated with type 1 immunity. It's a chronic inflammatory condition that affects the skin, hair, nail, and mucous membrane. It is again mediated by Th1 helper T cells through precise mechanisms though the precise mechanism is complex and it involves multiple immune pathways. Localized scleroderma or morphia is an autoimmune disorder that causes inflammation and thickening of localized areas of the skin. While it starts with type 1, Th1 and Th17 response, the evidence shows that later on it shifts to type 2 response once the fibrotic stage sets in. So it is actually touching both the limbs of immunity. Now I would like to touch the few important conditions that are linked to type 2 immunity. Type 2 immunity is characterized by Th helper 2 cells and mediated by cytokines like interleukin 4, 5, and 13, and is associated with allergic conditions. So, atopic dermatitis is one of the very important allergic conditions, an inflammatory skin disease driven by strong type 2 immune response and produced by and initiated by interleukin 4 and 13. It disrupts the skin barrier, making it more permeable to allergens and bacteria and contributes to the classical itch and inflammation. Chronic spontaneous urticaria is another allergic condition and thought by many as an autoimmune disorder. It involves the autoreactivation of T cells and mast cells, suggesting the type 2 immune component. Bullous pemphigoid. Bullous pemphigoid is an autoimmune blistering disease that involves type 2 hypersensitivity reaction. IgG antibodies targets the specific proteins in the skin, initiating an immune response that leads to formation of blisters. And histologically, bullous pemphigoid is associated with lots of eosinophils within the blistering cavity. Then eosinophilic esophagitis, it's not specifically a skin condition. It's a condition of esophagus with relevant comorbidity with atopic dermatitis and is type 2 mediated disease. And eosinophilic esophagitis shares underlying immunological pathways and can occur in patients with atopic skin disease. Prurigo nodularis. It's a neuroimmunological skin disease characterized by itchy, crusted nodules. The pathophysiology is complex, but it mainly involves the type 2 immunity with interleukin 17 and interleukin 22. Several skin conditions they overlap between the two limbs of immunity, and these overlapping heterogeneous immune conditions involve are the atopic dermatitis, alopecia areata, and vitiligo. Atopic dermatitis, or as it involves the eosinophils, is mainly described as type 2 response. However, it can involve T helper 1, Th17, and Th22 cytokines, which depends on the stage and subtype. Similarly, alopecia areata and vitiligo are traditionally considered as type 1 immune response, but many a times type 2 immune response is involved in its development and chronicity. Psoriasis and atopic dermatitis, some individuals may present with features of both disease, which is sometimes referred to as PSMA. The condition reflects an overlap of underlying immunological pathways. So many a times we come across such patients who are having the features of both psoriasis and atopic dermatitis. So these are the patients which belong to this overlapping syndrome known as PSEMA. Now, since the topic was chosen because of highlighting the different kind of treatments in the diseases which belongs to different limbs of immunity, so this is the point of stress in my lecture. That is distinct treatment strategies in type 1 immunity-derived skin diseases. So the main focus nowadays is the targeted or biological therapies. So since the main cytokines which are secreted in type 1 limb of immunity are the tumor necrotic factor alpha and interferon gamma along with interleukin 12, 23 and 17. So the biologics which work against these cytokines will be effective in treatment of diseases which are caused by type 1 immune response. So the tumor necrotic factor alpha antagonists include infliximab, adalimumab. They are both effective in psoriasis and several other autoimmune conditions involving tumor necrotic factor alpha. Then interleukin 23 and 12. Ustekinumab works by blocking the P40 subunit of interleukin 23 and 12, disrupting the Th1 and Th17 pathways, again effective in psoriasis. Then interleukin 17 inhibitors like secukinumab and ixekizumab are specifically targeting the interleukin 17 cytokines and again are very effective in treatment of psoriasis. Systemic agents. Oral medications like methotrexate, cyclosporin suppress the immune system and are used in several cases. Phototherapy reduce inflammation, slow skin cell growth, which is helpful in conditions like psoriasis. Distinct treatment strategies in type 2 immune-derived diseases. So again, we are talking about the biologics. The interleukin 4 are alpha inhibitors. Dupilumab blocks the shared receptors of interleukin 4 and 13 and is one of the key biological agents used in atopic dermatitis. Interleukin 13 inhibitors are the tralokinumab and lebrikizumab and is used in moderate to severe atopic dermatitis. Then anti-IgE therapy, which is omalizumab, it is useful in chronic spontaneous urticarias. JAK inhibitors. This class of small molecule inhibitors block the signaling cascade of many inflammatory cytokines, including those of type 2 immunity. So they are useful in moderate to severe atopic dermatitis. Then topical calcineurin inhibitors mediate medications like tacrolimus and pimecrolimus suppress the local immune response and are used for conditions like eczemas. Standard and overlapping treatment. While targeting treatments are specific, both type of immune skin diseases are managed with standard non-specific anti-inflammatory therapies for mild to moderate cases. So these drugs, they are effective against both type 1 and type 2 immune response, which are the topical and oral corticosteroids, tablets, injections, creams, and ointments. General immunosuppressants like methotrexate, primarily for type 1, and can also manage the symptoms in type 2. Then phototherapies are helpful in both psoriasis as well as in eczema. So this brings to end of a very short lecture. The main purpose, as you must have understood, is to highlight the few important diseases that belongs to type 1 and type 2 limb of immunity and highlighting the important cytokines that are produced in both type of immune responses and the biologics and other standard therapies that would work against these cytokines. In addition, I've also discussed the several overlap syndromes in which both the two limbs of immunity are involved. As well, I also discussed the general treatments for both kind of autoimmune diseases. So thank you very much and hope to see you soon in another lecture. Goodbye and have a good day.